Hello again, everybody. Today we'll be moving on from the cardiac unit and moving now into the vascular component of the cardiovascular system. So we'll be talking about vessel anatomy for the first two lectures here. So today we're going to focus specifically on, we'll do a broad introduction of the different types of vessels, and then we're going to focus today on the arteries. In vessel anatomy 2, we will then talk about capillary beds and then veins. All right. It may be helpful to pause here and print off worksheet 8 and then kind of actively fill that in as you watch the lecture. However, hopefully you're watching this lecture before class, but if you're not, these worksheets will still be due the following class period. So even though you might be watching this before class, it's not going to be due when you arrive in class. It would be due the next period if that worksheet would be collected. Also keep in mind that some questions on these upcoming worksheets you may not be able to complete while watching this video, and they'll be completed during an in-class activity.
All right, that is You're So Vain by Carly Simon. That's V-A-I-N. Here we're going to be talking about V-E-I-N, but funny nonetheless, and relates to this meme. I bet you thought this meme was about you. Believe it or not, this is take 2 for uploading this PowerPoint due to copyright infringement when I uploaded the original with Carly Simon. So I got this cover here. It sounds a little off, but it'll do the trick. Next meme here we got when you get up after spending 44 minutes on the toilet looking at memes. May or may not be guilty of that. And then we got a student submission from last year. We got your crush, her dad, her brother, her first love, her ex, and you, the measly pasture pipette. All right, let's go. Again, we'll have specific lecture objectives that we'll kind of check off as we go. So I won't read through these all now, but we'll just start at the top. So the first thing we're going to do is we're going to look at the general characteristics of vessels. So the structure, and we're going to focus on their 3 tunics. And then we're actually going to get into a little bit of histology, since we don't have that histology component with lab that we generally would have had within the 325 lab. We'll kind of talk about histology now. We'll put it in context for you. Okay? So you should be able here when we're done to differentiate based on these tunics and histology, the things that we're going to talk about between these different vessel types. So let's go. There are 3 main types of blood vessels, and we classify them based on function. So first up, we have the arteries. Okay, you've probably heard that arteries carry oxygenated blood, and that is true the majority of the time, though there are exceptions, and you can probably think of a couple. You just finished up the cardiac unit. So instead, we say that arteries carry blood away from the heart to the capillaries. So next up, we have the capillaries. They are microscopic, so very, very small, and they tend to be very porous. And they're great for exchanging substances between the blood and the tissues. So we can get gas exchange, nutrient exchange. And then finally, we finish up with veins. So veins drain blood from those capillaries, and they transport it back to the heart. And we can say that veins carry deoxygenated blood the majority of the time. Okay, and these arteries, capillaries, and veins, their walls are composed of layers that we call tunics. You may have heard of tunics before. It's a coat or a covering, if you've been to the Renaissance Festival, or fans of Zelda. My wife got me Zelda for Christmas. Wants me to relive 8th grade, I guess, when I sat around playing that, but it's been fun. So they have these 3 layers, and they surround the hollow opening of the vessel that we call the lumen. So that's that hollow center. Okay. Now the 3 tunics we're going to talk about are the tunica intima, intimate, think the innermost, the tunica media, media middle, and then the tunica externa, the externalmost coat or covering that tunic. Our 3 vessel types, the veins, the arteries, and the capillaries, they're all going to have slightly different composition of these tunics, right? And that's going to give us clues about their functions. So let's start with the tunica intima. Intima, think intimate. It's that innermost layer of the vessel wall that hugs that lumen. Okay? So it's made up of an endothelial layer, which in fact is simple squamous epithelium, and that's surrounded by a subendothelial layer of areolar connective tissue. So we can see both these in this illustration here if I bust out my marker. So tunica intima, and it's made up of these two layers here, endothelium and subendothelial layer. Okay. Now I mentioned some histology here, so let's take a look at that. We'll take a quick short dip into histology here. So there are 4 different tissue types within the human body. And 3 of these we've actually talked about pretty extensively so far. So we started out last semester with connective tissue, where we talked about bone and cartilage. Okay. And then we moved into nervous tissue, where we talked about the neurons, right? Transmission of nerve impulses. And then we finished up with skeletal muscle. And by now you've had cardiac muscle as well. And we'll be talking about smooth muscle shortly. But now we're going to talk about epithelial tissue. Epithelial tissue is comprised of these tightly packed cells, and we find them covering the body as well as lining body cavities, and they also form glands. So therefore, we see that they're involved with exchange of materials, so they tend to be highly permeable in certain areas, but they're also capable of making barriers or defenses. So think of your skin, right? They're involved with secretion, that would be the role of those glands, and then they tend to be highly innervated, so they're good with sensation as well. There are 2 types of epithelial tissues. We have epithelial sheets, which help create boundaries, primarily what we're going to be focusing on here, and then they also comprise those secretory glands. And you are familiar with epithelial cells. We talked about them last semester when we talked about moving things from that intestinal lumen into the blood, right? So you recognize this here, right? We have an apical side or a luminal side. Your lumen would be right here. Because these epithelial cells, they line those hollow cavities or organs of the body. Okay, so we said that they have polarity apical, and then this would be the basal lamina down here. And they're tightly packed and then joined by these intracellular attachments. Remember we talked about tight junctions or those cellular adhesion molecules, right, that we can see down here. A couple different ways we can classify epithelial tissue then. The first is how many layers does it have? So if it's simple epithelium, simple, it is 1 layer. Okay? If it's stratified, that just means more than 1 layer. Okay? And we can also differentiate it based on the shape of the cells. So we can have a squamous cell. Squamous means scale-like, and in fact you can see it's flat, like a scale. It can be cuboidal, so shaped like a cube, or columnar, right? So pretty simple. And we said when we were talking about that tunica intima that innermost layer is made up of simple squamous epithelium. Okay, what that does is creates a smooth surface for the blood to move through, so less friction for those blood cells moving through that vessel. And we also said that this epithelial tissue is good for secretion. In fact, here we can secrete things like nitrous oxide that help with dilation. Okay? And we can see here, if we're looking at this vessel, here's a staining, so a histological prep. You can see the red blood cells moving through this vessel, and then we have the flattened nucleus here associated with these squamous cells for the simple squamous epithelium. See how tightly packed they are through here to form those vessel walls. And next up, we have the middle layer of the vessel, the tunica media, media meaning middle. And we can see here that these are circularly arranged layers of smooth muscle, and then they have some elastic fibers moving within them. So tunica media right here, and we see this circular arrangement of those smooth muscle cells here. Notice these layers of elastic lamina. There's an internal and an external. Those aren't part of our media. You can note they're there, but don't pay too much attention right now. So we have the circular arrangement, right, of this smooth muscle around that innermost layer. Why do we have that? So for a think, pair, share, I guess you can't really pair up, but you can think and then share out loud to your roommate. Why have this circular arrangement? Why not run longitudinally? So think about that for a second. Well, as you might have guessed, we can see with the circular arrangement that a contraction of that smooth muscle then in that circular arrangement is going to cause vasoconstriction. It's going to narrow that lumen, make it smaller. Whereas relaxation is going to lead to vasodilation and widen that lumen. So that's why we have that circular arrangement. All right, we got another histological image here, just kind of reiterate what we were talking about. So here we can see that open area, the lumen, right? And then the adjacent layer, or innermost tunic, the tunica intima. And then next to that, then we have the tunica media. Okay, so that's that middle layer. You can see the circular arrangement of that smooth muscle really well now. And as this GIF here is illustrating, that gives us the ability to vasoconstrict or vasodilate. Another image here. Okay. Perhaps we get some nitrous oxide release. That's that paracrine that brings about local arteriolar vasodilation. Gives us that relaxation of the smooth muscle, and it's going to widen that lumen for us. All right, and lastly, we have the tunica externa. So remember that, just add an L to that. Tunica external. So this is the outermost layer of the vessel. It's made up of areolar connective tissue, which we'll talk about shortly, that has both elastic and collagen fibers. And really this layer just helps anchor it to nearby structures. So we can look here at both our artery and our vein, and we can see this really well, the outermost layer here of the tunica externa. On that previous slide there, you might have seen that it was called the tunica adventitia, just another term for this, but it's the same thing. Okay. And this layer, it may contain what we call a vasa vasorum. Okay? This is a grouping of small arteries that helps deliver a blood supply to these very large vessels, right? So it's kind of meta. You got to think about these vessels are so large, they need their own blood supply. So it provides the blood and the nutrients for that outermost tunica externa. The vasa vasorum is, in Latin, means vessels of the vessels, which in fact is what they are. If you're curious what that would look like, we found an image here showing the vasa vasorum, so we can see the blood supply that is going to this outermost layer of the blood vessel. Okay. And we've talked about connective tissue before. So we talked about structural framework of the body when we talked about bone, or how blood is a connective tissue because it's involved in the transportation of fluids and dissolved materials. We have those that connect other tissue types or support them. So we talked about things like ligaments and tendons that connect muscle and bone. We get protection for organs and energy storage from things like adipose tissue. But the one we're going to look at here, which we haven't talked about too much, is areolar connective tissue. Okay. Now, connective tissue in general is a sparse collection of cells. So this is unlike the epithelial tissue we looked at, where they're just a butt up to one another, form that barrier, right? Connected to one another physically. And specifically, areolar connective tissue, we see that there are just a loose collection of cells. So if I point a few out here, if we get this image here, we can see there's some fibroblasts within there, maybe some macrophages. And we also see this loose network of elastin fibers as well as collagen fibers. So areolar connective tissue is actually the least specialized connective tissue, and it contains all the cells and fibers that are found in all the other connective tissues. Okay? And it has an extensive blood supply. Okay? We saw that with that vasa vasorum. Okay? And it's found underneath the epithelial layer, and that's because it provides cushioning and elasticity. One of the properties we mentioned of the areolar connective tissue was the fact that it has these strands of collagen going throughout it. So we can see that here. So collagen is a structural protein. Okay, so it's going to help give some definite form to the connective tissue. And the other protein we mentioned is elastin. And elastin, you can kind of think of this web of rubber bands, right? It's a protein that gives the connective tissue its elastic properties. if you pinch the skin on the back of your hand, for example, and then it retracts back to the original position, that's due to the elastin. You've probably heard of different skin care products that have collagen and elastin in them, and it's kind of gimmicky, right? Because unless it can help your skin make more collagen and elastin, it's not really going to do too much, but who knows? So done with histology now. I can talk, or I should introduce this idea of companion vessels. So companion vessels are what they sound. It's an artery and a vein that lay right next to each other that are going to serve the same body region. So you can think of one, the artery is delivering oxygenated blood, and then that other companion vessel, the vein, that is going to take that deoxygenated blood back to the heart. Okay. So it also helps prevent things like pooling in different tissues. You know you got a blood supply there. Well, we got a way to get the blood back out. Okay. Now, as we put these two side by side, these companion vessels here, the artery and the vein, some differences between those two vessels are readily apparent. So what I'd like you to do here is take a second, pause this, scratch a piece of paper, list the differences you see between the vein and the artery. All right, let's see how you did. So, split this up. Probably the biggest or most apparent difference between the veins and the arteries might be that the veins have a thicker tunica externa, so that external layer when compared to the arteries. Okay. They have a much larger lumen, we can see as well, compared to the arteries. Okay. And then something, I guess, less readily apparent would be that they have less elastin and collagen fibers. And because of that less structural support, they actually collapse if there's no blood within the vessels. So veins will collapse. We can compare that then to arteries. Now, if we look at that previous image I showed you on the previous slide, we see that they have a thicker tunica media, so more smooth muscle than the veins, and therefore a narrow lumen, which we mentioned previously. Okay. And then, in contrast to this, they have more elastin and collagen fibers, and that allows them to spring back. So they're more resilient and resistant to changes in blood pressure, right? You can picture that rubber-like quality of the elastin, allowing it to retain its shape and spring back to the original conformation. And we haven't said much about capillaries yet, but I did want to point out that in regards to the tunics, the layers we've talked about, they contain only the tunica intima, so that innermost layer. And if you look back at the tunica intima, we mentioned how there was an epithelial layer and then a subendothelial layer made up of areolar connective tissue. Well, they lack that subendothelial layer of areolar connective tissue as well. So they have only tunica intima with no subendothelial layer. And this helps because remember that at the capillaries, this is where we're doing exchange of nutrients and gases, and those thin walls allow for a quicker exchange. Allows for a quicker exchange of nutrients and gases. I was finishing up on that last slide. We got cut off there. All right, so now we've looked at the differences between the different types of vessels, the veins, the arteries, and the capillaries in regards to their tunics. Well, now let's move on to arteries and look at the three different kinds and then how they differ from one another as well. So we're going to talk about elastic, muscular, and then the arterioles. Arteries then deliver oxygenated blood from the heart, most of the time, right? But remember, we're moving away from the heart, so it serves as this rapid transit system from blood to systemic tissues. And what's kind of cool about arteries is that they continue to exert pressure during diastole. So systole, we get that heart contraction, we're delivering the blood systemically, while when that heart relaxes during diastole, we're continue to get that driving force with the arteries. And we'll look at exactly how that happens shortly. And then as we mentioned before, they do have more elastin and collagen fibers than the vein counterparts. And this allows them to spring back. So the collagen fibers, that's going to provide that tensile strength. So if you were to pull on it. Whereas the elastin fibers, they provide elasticity, kind of like a balloon if you were to blow that up, and then it shrinks back down. Some trends that we see with arteries is that they're going to branch into smaller and smaller vessels as we move away from the heart to those capillary beds. So we're going to start out with elastic arteries, the largest, move to muscular arteries, and then finish with the arterioles, the smallest of the arteries. And some trends that we see is that there is this decrease in lumen diameter as we move away from the heart, as well as a decrease in the amount of elastin. Remember, that's that protein that gives it the elastic characteristic that allows it to expand and contract rapidly without doing damage to that vessel. The other thing that we see, contrastingly, is that as we move away from the heart, we see more smooth muscle within that tunica media. Beginning then with the elastic arteries, these are the largest of the arteries, and they have a diameter that ranges from 2.5 to 1 centimeters. So as an example, our quarter dollar, that's about 2.5 centimeters. Okay, so that's pretty big. There are oftentimes, you'll see them called conducting arteries, and that's because they're conducting blood from the heart to those smaller muscular arteries. As their name suggests here, elastic arteries, they have a large proportion of those elastin fibers, which allows for quick stretch and recoil. So let me just ask you then, we'll do a think, pair, share here. Why is it important for these elastic arteries to have that elastic property? Or in other words, what does that allow for? So take a second, think about that. Well, if you're paying close attention on the previous two slides, the answer is that it helps propel the blood through the arteries during diastole. So after systole, and we see that diastole where the heart is not contracting, we still get propulsion of blood through the system. So how does that work? Well, let's look at this top image here. This is showing when the heart is in systole, or contracting and emptying. And with that, we see this corresponding expansion of the arteries due to pushing more blood volume into them. So you can see here at the top, these arteries are expanded because the heart is in systole. So what happens then when the heart is in diastole? Well, think of this as kind of like a balloon being pumped up. So if this is you blowing on that balloon, right, your cheeks are contracting and it's blowing up this artery. Well then, when the heart relaxes and it's in diastole, the blood continues to be propelled by the elasticity of that elastic artery. Okay, it's like that balloon recoils. So that rubber property of the balloon, well, this artery is then going to contract and it's going to propel that blood forward, okay, onto the other arteries. And I should point out here that those elastic fibers, they're found in all the tunic layers of these elastic arteries. And some good examples of elastic arteries that we've seen before would be the aorta, the pulmonary trunk, as well as the common carotid or iliac arteries. Then branching from those elastic arteries, we have the muscular arteries. And these allow us to distribute blood to the specific body regions. Okay. These have diameters that range from 1 centimeter to 0.3 millimeters. So for example, 1 centimeter is about the top of this staple shown here. Okay. So these are medium-sized arteries, and they have that really muscular tunica media. There's more smooth muscle cells that are found in multiple layers. So this is relatively thicker compared to the other arteries. And unlike the elastic arteries that had the elastin in all three of the tunics, here that elastic tissue is confined to two specific layers. Okay, we have the internal elastic lamina and the external elastic lamina. And you can see that sandwiches that tunica media. Okay? Examples of these would be our named arteries, so the brachial arteries or the coronary arteries. What this tunica media, this thicker layer of smooth muscle cells allows for was obviously more muscle and then less elastin. And this allows for better constriction or dilation ability, which is going to be important for these arteries. And finally, we have the smallest of our arteries, the arterioles. These have diameters that range from 0.3 millimeters to 10 micrometers. 0.3 millimeters, for example, would be this needle-tipped pen. You can buy these on Amazon. This is a 0.3 millimeter pen tip, so very fine. And for this reason, these arterioles, they're so small, they're not named. As far as tunics, they can range from having all three to just a tunica intima with a little bit of smooth muscle. And they'll always have less than 6 layers of smooth muscle, so less compared to our muscular arteries. And they exist in this somewhat constricted state, and we say that they exhibit vasomotor tone. Okay? And that's regulated by the vasomotor center within the brainstem, so they're just somewhat constricted. Let's say we have some sympathetic innervation with these arterioles. Well, that can induce further constriction. And this is important for regulating blood pressure and flow to the different areas of the body. So, for example, if we get some vasoconstriction, that's going to limit blood flow to an area. And we'll talk about this more in the future, but what we see here is that arterioles, they play a large role in regulation of systemic blood pressure and flow. And now that we've talked about arteries, I want to apply what we know and talk about the pathophysiology, which is the physiology of a disease. And specifically here, we're going to be talking about coronary artery disease and some optional treatments as well. This first mini case study will be on coronary artery disease, or CAD for short. This is classified as damage or disease in the heart's major blood vessels. What we see is this build-up of plaque. Plaque is this fatty, waxy substance that causes the arteries to narrow, or they become occluded, we say. And that limits blood flow to the heart. So we're limiting the heart's own blood supply. So the coronary blood flow can't keep up with rising oxygen needs. So you might feel okay at rest, but not with increased oxygen needs. Let's say you're out exercising. Okay, so we're diminishing that blood flow to the heart, and this can lead to death. In fact, it's about a third of the deaths over 35 years old, and it's a leading cause of death within the U.S. Result of coronary artery disease could be myocardial ischemia. Remember, ischemia is when the tissues aren't getting enough oxygen. So here we're specifically talking about when the blood flow to your heart is limited. And that prevents the heart from getting enough oxygen and therefore doing its job correctly. It reduces its ability to contract as well as it should. So here we're seeing reduced blood flow as a result of partial or complete blockage of your heart's arteries. And this is due to the formation of these atherosclerotic plaques. So you've probably heard of atherosclerosis. So let's take a look at what that is. So the buildup of that plaque can cause atherosclerosis. We say that this is a progressive degenerative arterial disease. Progressive in that it gets worse over time, and degenerative in that it continues to adversely affect that tissue or organ over time as well. And it is an arterial disease. So what we see is this gradual blockage of these vessels, or what we call occlusion, and it reduces the blood flow within these arteries. Now, contrary to what you may think or popular belief, it's not cholesterol and fats adhering directly to the lining of these vessels. In fact, we form these plaques beneath the vessel lining wall, so underneath that endothelial layer associated with the tunica intima. And that's where we get the buildup of these plaques, and they have this lipid-rich fatty core, and then it bulges out into the lumen, reducing blood flow. Atherosclerosis can occur within any of the arteries throughout the body, but the most serious damage would occur if we get atherosclerosis in the supply to the heart or the brain, and that's where we can see stroke or heart attack. So over time with that buildup, we could see 100% occlusion, or we could get a plaque, right? So the plaque builds up within that vessel wall, and if that breaks off and travels in the blood, it can block blood flow to a certain area. And that, if we're talking about the heart, that could lead to cardiac infarction. So that blood supply to that area of the heart is going to be blocked by that clot, that embolism, and it can lead to heart attack due to no oxygen being delivered to that tissue. So individuals with higher than normal blood cholesterol, which we call hypercholesteremia, are going to be more prone to atherosclerosis. And in fact, we see that males tend to be more affected than females. Things that are going to exacerbate this are going to be smoking and hypertension. So what are the treatments for atherosclerosis? Well, one of them is angioplasty, where we're expanding a narrowed region of that artery. We're trying to open up that occlusion, or coronary bypass surgery. So let's take a look at these. Now, about a year ago, my mom sent me this image here on the left, and this is what my uncle's doctor drew up on the board after his hospital visit. And what we see here is that within the right coronary artery, I'll pop this up here. So right here, we see that there is 90% occlusion. And then if we look over, we have 99% in the left circumflex, and then 85% in the anterior descending, or that anterior interventricular artery. Okay? So basically, what they told my uncle is that he needs bypass surgery. And the way bypass surgery works is you bypass that occlusion. You bypass those plaques. So the heart needs its blood supply. So what you do is you take some vessel from somewhere else in the body and you create basically a shunt to get blood to that area. So for example, a common one here would be taking the saphenous vein from the leg, and we're going to bypass that. So now the fresh oxygenated blood can move to this lower area of the heart. Right? We're doing the same thing over here. We can take this internal mammary artery, that's the internal thoracic artery, bend it down, attach it, and bypass this plaque here, and so this area of the heart also receives oxygenated blood. The other thing we could do would be angioplasty. So let's take a look at that. Another common treatment, depending on the severity, could be what we call an angioplasty. And this involves taking a catheter and oftentimes placing a stent to help remove that occlusion or widen that vessel back up to allow for better blood flow.